Dr. Deborah Peinels, a psychiatrist who has worked with people with serious mental illness and intellectual and developmental disabilities throughout my career. I am a senior medical and forensic advisor at the National Association of State Mental Health Program Directors, a consultant to the National Association of Directors of Developmental Disability Services, and adjunct clinical professor of psychiatry at the University of Michigan Medical School. In this module, we will discuss important considerations for prescribing and monitoring side effects and adherence of pharmacological interventions in individuals with IDD. Guidelines for prescribing short-term use of psychotropic medications in children with IDD include starting medication at a low dose and slowly titrating because children with IDD respond to lower doses more commonly than typically developing children. It is generally advisable to make one medication change at a time and track responses and any side effects before making other changes. Coordinate with the child's behaviorist to provide behavioral data at each medication follow-up visit. If there's no behaviorist, check in with parents, see what information is available from schools. Closely monitor for side effects because of increased sensitivity, and consider prescribing psychotropic medications in a stepwise approach once the child is receiving appropriate behavioral interventions and has sustained periods of stability. For adults with IDD, some of the same steps occur. For example, lower dosing initially is important, and monitoring of side effects is a traditional strategy that is necessary in this population. In thinking about drug choices, the prescriber should be watchful and minimize the use of medications that might worsen underlying cardiometabolic or respiratory disorders, or even dementia that can be seen in people with IDD. People with IDD may also have higher rates of epilepsy than the general population, and some psychotropic medications can lower the seizure threshold. Thus, there should be monitoring for seizures. Some medications also induce metabolism of other medications, and that can impact dosing. A pharmacist who understands these drug-drug interactions can offer useful guidance to the prescriber where these questions emerge. The prescribing of multiple medications or co-prescribing warrants close monitoring. For people with IDD, the preparation of the medication, swallowing requirements, or any other issues the individual may have with absorption of medications or fear of injections or the need for laboratory testing should all be taken into account, as that can add challenges to ongoing adherence. When starting treatment, education of the patient and the caregivers will be important so everyone is aligned into what to monitor and what to expect. Baseline laboratory tests should be obtained as needed, and this should be part of the initial informed consent conversations. Understand that the person with IDD may be hesitant to bring up issues, as the power dynamic with the prescriber can be intimidating. So offering opportunities for the individual to express themselves, even if it is nonverbal communication, is very important. Regular appointments set up in advance will provide a good structure for review of the effectiveness of the medications and the emergence of any side effects. If the psychopharmacological approach is not working after an adequate trial, discontinue the medication. Be mindful of withdrawal reactions and approach stopping medications cautiously. This can be especially true for medications with anticholinergic and serotonergic properties, among others. Prescribing psychotropic medications and working with individuals with IDD and other cognitive challenges can be rewarding when the medication helps alleviate some suffering or decreases symptoms that interfere with functioning. And it can be very concerning when the medications cause unnecessary side effects. It can be rewarding to develop a trusting relationship between the prescriber and the individual being served, to understand how psychopharmacological prescribing is helpful and also to be responsive when it is not helpful. It is important that the rapport and therapeutic alliance be at the forefront of that relationship to help achieve the best outcomes.